Well, I mean, there's really several classes of drugs that are treated for particularly opioid use disorders, and that's buprenorphine, which is a full mu opioid agonist, which is where they get the analgesic effect, but it also has an affinity to the kappa receptor, which is what makes it sort of lower liability in terms of abuse. I think buprenorphine has been around for a long time. In the 1980s, it was really an injectable analgesic, and then they found out that they could use it to treat heroin addicts. There's been sort of a push to use more and more buprenorphine for the patients with opioid use disorders. Older than buprenorphine has been methadone, which is a full mu agonist, and again, it was developed by the Germans, I think, in World War II, and then they had to sell it to a drug company for $1, which is what happens when you try to take over the world. Methadone is a very good medication for opioid use disorders. The problem is it's a little trickier, a little more dangerous if you're using it out of the office versus a methadone clinic. Lots of people use methadone as a primary analgesic because it has a natural long half-life and you don't build as much tolerance. But the pharmacokinetics are a little bit, again, trickier than buprenorphine in terms of respiratory depression. It's much safer with buprenorphine. There's been a real push for primary care practitioners, both nurse practitioners and physicians, to get buprenorphine licensed and start treating these patients that have opioid use disorders because we just don't have enough treatment facilities. And we have a lot of CDC guidelines, and everyone has a guideline about treating and managing these patients, but they're complex and we don't have access. So there's been a real push both at my institution and other institutions that primary care doctors start delivering buprenorphine. Now, that's a good thing, but treating patients who have a substance use disorder requires a multifactorial approach. You need to be in counseling, you need to get the family involved, so it's not just giving this molecule versus that molecule. And I think physicians and nurse practitioners and PAs, they should be aware of what the resources are in their neighborhood. And there's a wonderful website through SAMHSA that's called findtreatment.gov, and you can look up any mental health or substance abuse treatment program, what medication, what insurances they take. So again, be aware of the resources. Know who your buprenorphine providers are in your town. Make sure that they're not just handing out buprenorphine, but they also are referring people to counseling, to AA, NA. So it's again a multimodal approach because of the complexity of it. Make sure that their pain is being treated. Just treating their substance use disorder and not treating their pain is going to lead to relapse. So again, I think these are the kind of factors you need to be considering when you manage these patients.